So we're both proudly South African, but we're living in two very different countries.
Yeah.
Thank you so much for doing this with me. I'm sorry that it's been a little bit of a mission to go live, but we are here now. So now we know for the future we need to do it on phones.
Yes.
The way that I met you, I think it's a pretty special story, really, because I saw your TED Talks, and you came out, and I think the first thing you said was that you're autistic, and well, no, that's not the first thing you said, but you did mention that you're autistic, and it's very difficult for women to come out saying that they're autistic. And your talk was amazing. It floored me. I really thought it was really, really good. And I think a lot of people are actually struggling with many of the things that you mentioned in that TED Talks. And then I contacted you. I never thought you would reply.
Yes, I think we connected. I think we first connected, I don't know if it was via LinkedIn or if we connected directly on WhatsApp. But I do remember that it was nice connecting with a fellow South African who was also a woman, who also had an understanding of the background, because I remember what it was like in South Africa before I was diagnosed, and even the idea that I could be autistic was something that a lot of people couldn't wrap their heads around or accept. So it was really, for me, it was also like, oh wow, like someone knows like where I'm, like my background and stuff, and also gets this, this journey that I'm on to try and deal with being autistic. Yeah.
I never asked you, but when were you actually diagnosed?
In 2013. So I tried to get diagnosed in South Africa. It didn't work. So part of the reason why I came to Germany, I mean, it was a small part, but part of the reason why I came to Germany was when I was in South Africa, I found out that they're like even massive centers where you can go and be diagnosed here, and it's quite anonymous. And so I thought, oh well, if I can make it to Germany, then I can probably see if I can actually get a diagnosis. So it was in 2013.
That was your reason initially to go to Germany.
Well, this was part of the reason to come here. I mean, part of it was obviously I have been fascinated with German history for a long time. That's one of my special interests. And I also didn't feel like I think socially, obviously in South Africa, it was really hard for me being not speaking an African language, and just generally being considered odd, and I wanted to see what it would be like to live in a different country. Oh, and obviously also because I thought that the social support systems, I guess, and the government support systems for freelancers were better in Europe than they are in South Africa. But all of that stuff, I mean, I could have chosen any other country, but specifically in Germany, they have a big, I think the structures for diagnosing autism here are really, really good. The only place that I've seen better structures for that is in the Netherlands. But Germany is really, and in the Netherlands it costs more. But I had to come to Germany to get a diagnosis at all, because there were just no specialists in South Africa who focused on diagnosing autism in adults.
Yeah, I think it's a little bit better now, but it's still, in various countries, because I was in Indonesia for a while, they're still struggling, especially with people that are older, to get a diagnosis when you're older.
Mm-hmm.
I think that's, and I mean, obviously we want to diagnose at a younger age, because that helps any person to understand a little bit more about themselves and where they would need support, and just coming to terms with being different is fine, but there are ways to help yourself in a little bit of a better way or a faster way, and just accepting yourself more for who you are, because I think it can foster into some feelings of anxiety perhaps sometimes.
Yeah, that's definitely, I mean, I have to say, speaking from my own experience, it was always very interesting because other people always sort of knew that there was something different about me, and they treated me like they saw that there was something different about me. Um, in not always in nice ways. I mean, sometimes I did get bullied a lot at school, and that was, I think psychologically, that I don't think those scars will ever really go away from being bullied. But I think it would have helped me so much to have a diagnosis earlier, because at least I would have understood that the way that I see the world is very different to the way that other people see the world. And just going into life with that understanding now makes it so much easier to understand people's behavior. I understand when social interactions don't go well. I don't blame myself for not having social skills or not being whatever enough or friendly enough or helpful enough or whatever. I can accept that, look, there's some fundamental differences in just the way that autistic people and non-autistic people communicate. And so that's helped me a lot. And I think, yes, being diagnosed younger, I feel like it would have made such a big difference. It would have made such a big difference to be able to, even just to be able to explain to people, even if they didn't understand or they didn't believe, even to be able to just say to people, I'm autistic, I'm different, and I have a label for my difference. Being able to have that kind of armor would have been great. Growing up without it, it was, yeah, let's just say a lot of people tried to push me into a lot of molds that they wanted me to fit into. And they didn't understand why I didn't just sort of slot in there and understand why it was supposed to be that way, or why I resisted, or why. I mean, I'll just give an example. There was a friend of mine who, you know, she took me shopping. She bought a whole new wardrobe for me and stuff, and then I would only wear the clothes some of the time, and eventually I stopped wearing them completely. And she was baffled by this. She was like, "But you have all these clothes now. I mean, now you should be able to, you know, figure this out on your own." And I was like,
yeah, no, it doesn't work like that. It doesn't quite work like that. And it's funny that you say that, because I think I find that a lot. Well, I do find that a lot with our parents, is they sometimes want their child to go to a specific activity because, you know, they planned it and it's a really nice activity, family activity, but it might not be what their child is interested in. So it's so important to know that our interests are different, and that's perfectly fine. But to figure out, like, what is my child interested in from a young age? If you've got that label and you know, okay, well, I might actually enjoy something that is not, you know, the same as the peers or the same as their siblings. It might be that you're really interested in dinosaurs, or, you know, you're really interested in engineering or something like that from a very young age, but just giving that kind of leeway for your child to explore what they're passionate about from a young age.
I think that's such an important point, because I have to give a lot of credit to my parents for, I mean, even without the label, they did a lot of things that sort of turned me into the person that I am today. Obviously, I mean, I think we all are grateful to our parents for that. But specifically in terms of being autistic, they definitely gave me that space. They gave me the space to have those interests. They gave me the space to do those things. I mean, I remember exactly what you're talking about. The you know, your parents plan to do something and you don't really want to do it and you don't want to go, but they can't leave you at home on your own because you're too young, or it's just not practical for them to have someone look after you. And they would negotiate. They would say, okay, well, look, if you come with us, we'll bring this book that you like, and you can sit and read the book. Or when we got to the place, they would find like building blocks and toys that you could play with your hands, so that even if I didn't feel like interacting with people, I could still be physical, and that would make, and what the other thing about that was, doing those things would make other kids want to do those things with me. That was also very interesting. That
that's a good point.
It brings, yeah, it brings, it's like it means that the autistic child then doesn't have to make the effort to go to the other kids, which is hard anyway. I mean, I think kids in general find that hard. They have something that makes other kids come to them, and then they can talk about it. And we all know special interests. I mean, you can talk for hours. Um, um, still have to remember an adult.
That's why you and I can talk for hours. I think we've said that we wanted to do something like this for almost a year now, where we said, okay, well, we're having all these really cool conversations, and I feel like more people need to hear it. And then we wanted to plan something, and somebody with ADHD and somebody that's autistic trying to plan something ahead is a little bit of a disaster for us. So going live, I mean, it wasn't the smoothest start to the live conversation, but we're here now, and I think it might really help parents and other autistic adults as well.
Yes.
I feel like every time I speak to you, I gain so much, and that's not why I'm your friend, because I love you for everything that you are. But
That's
you
so
do
cool.
give me so much insight, and you know, just like understanding more from an autistic person's perspective. Because your story for me is super interesting. I don't know if you want to just indulge a bit in your past and your training and, you know.
Oh, yes.
For history.
Good idea. Good idea. I want to say though, it feels so good to hear someone say that they appreciate me and the things that I say, because I must say, for a lot of my life, people have either told me I talk too much, or I talk about the wrong things, or I'm boring, or, you know, so it really touches my heart. I mean, that's one of the reasons why I love you, and I'm so glad we're doing this. But specifically about my history, yes. So in South Africa, I studied medicine at the University of Cape Town. The studying itself, I don't know if I've said this to you directly, but the period of studying was actually one of the hardest things, because I had to go into these lecture halls. And now in lecture halls, it was at the time when everyone was still writing with pen and paper. I'm sure people use digital products now, but everyone was writing with pen and paper. So you had 200 to 300 people, at least in the first couple of years, 200 to 300 people in a lecture hall with the lecture hall acoustics, scribbling, writing notes, passing papers, you know, picking up it. The noise. Oh, the noise was just, it was horrible. It was absolutely unbearable for me. And so I would only go to lectures if I really had to. And the rest I would go to the library and get the books and study on my own. I mean, for the non-practical stuff. For the practical stuff, obviously you have to go into the hospital with the patients. But in the lecture halls, I couldn't deal with the lecture halls and the noise and all that kind of thing. Sitting at the back was a great strategy. But the reason why I bring that up is because every year they would do the you know, university administration would call me in and say, this is the year that you're going to fail. There's no way you can pass this year if you don't come to lectures. Really? So yes, so I just want to, I'm saying this because I know that there are parents out there who get told over and over again, your child can't do this. Your child will never be able to do that. There's no way your child will, and please don't listen to them. There's always a way. There's always a way. So, but after, I mean, I made it through. I passed with good marks. I ended up, and I mean, as I say, working in the clinical settings was so much better. There wasn't that overstimulation from the noise. And then I worked in a government hospital in South Africa for 2 years. That's a whole other story for another day. But then after, so I did struggle to deal with my medical colleagues. So that was the thing. The patients, I had a great relationship with the patients, but I struggled with the work politics and the competition and all this kind of stuff. I didn't understand that kind of stuff. And as a result,
was it the, sorry to interrupt, was it just the social interaction and like knowing when somebody is actually talking about you or with you, or
so
what was it?
It's a bit of a tricky one in South Africa again. So the language played a role because I didn't speak an African language, and a lot of the people in the hospital thought that I must be either making it up or lying or pretending, because I mean, the phrase that people will say in South Africa a lot, you're trying to be white. You know, it's like, so people developed this impression of who I was and thought that I was putting on a character for whatever reason. And they didn't realize that that's just how I was. But then it was also kind of I mean, because I didn't have a social life, I was also very involved in my work. So I got a lot of, I mean, my superiors liked me and they would give me lots of things to do. And I was given a lot of responsibility, and that was, for me, a positive thing. But for other people, it kind of made it seem like I was like the teacher's pet type of thing, you know?
Like a bit antisocial.
So it's like,
okay.
This was obviously, at the time I had this is something that I've only figured out after years of thinking about it afterwards, right? This is, at the time I thought I'm friendly and I'm nice and I'm helping people with their work, and if someone can't do a shift, I'm jumping in and saying, oh, let me do your shift for you. I mean, I don't have a social life, I don't have friends, I don't have a relationship anyway, so and I thought that I was doing my best to get people to like me, but there were so many things about who I was that made people think no. And in the end, that's what made me leave. And so I decided to, because I have always been fascinated with computers. I've spent more time with computers than I have with human beings. So, so
it's easier. It's easier to deal with computers. I'm just gonna close this window.
Yes. No, go ahead. Yes.
Yeah.
Yes. Well, I can tell you, just predictability. The fact that you determine what the computer does, and you can't do that with people. It's it makes a huge difference.
It's a formula, and it's not cranky when it's tired.
Yes. And it doesn't think that you have intentions that you don't have, and tries to play games with you.
It's not manipulative.
Yes.
What you see, what you get.
Yes.
Okay, yeah.
That's
what I love about systems and computers too.
It's one of I actually feel like, being an autistic person who's grown up in the age of computers, I can't imagine what it must have been like to grow up without computers.
So just to give a bit of background with Sarai, she studied medicine, and then she became a medical translator. We've been friends now for about 4 years, and I just messaged her after I saw a talk on TED Talks, and we became really good friends. So yeah, so she's been quite a helpful person in my life, and I think she gives a lot of good input for parents, and she gives a lot of input, a lot of insights for autistic adults too. I'm just trying to add her again. What we're planning to do is a series on employment. We want to do a series on employment and on relationships. Hi, you're back.
I'm so sorry about that.
No worries. No. I think this is good. This is life, right? So I was actually just saying a little bit about how we met and that we became really good friends in the last 4 years. The interesting thing is that we've never met in person, and I see you as one of my closest friends, which is like, that is bizarre, but it is true.
So I really appreciate it, because it's so nice to know that you can form these types of connections across, time and space.
But also, I think what I was also saying now is that we're planning to launch a few series on relationships and employment.
Yes.
Because there's a big gap of, there's a lot of services available for younger kids, and we help younger kids too at AIMS Global, but we're focusing now more on autistic adults and adolescents and adults to try and help them with employment, getting ready for employment, getting ready for just job interviews. First of all, choosing which field to go into. I mean, that's a minefield.
Yes.
And then getting ready for these, job interviews, and also maintaining jobs. And the same for relationships, friendships, and romantic relationships.
Yeah.
So I don't know if you wanted to maybe chat a little bit about like some of the difficulties that you had choosing a job. I know that you were kind of leading into that.
Yes. So I'll put it this way. I started off as a doctor. I ended up working as an IT consultant for 4 years, and then I work as a freelance translator now, which is the job that has stuck. That's what I wanted to say before I got cut off. Was I ran away from medicine to IT because of computers, and found the same kind of. It's even worse in sort of consulting, because then you have to present a certain image. But to answer your question about choosing the field that I wanted to study, I went with the things that I enjoyed doing the most. So when I was good at mathematics, but I didn't like having to check my own work. I'm not going to lie. I preferred subjects where I could just memorize things. Okay. So I think for people who have more of I think being autistic, you have it's almost like you have an inbuilt analytic mind, because you have to break the world down into little pieces to understand it in the first place. So I think subjects like mathematics and science and things like that are probably something that most, or even history, are something that most autistic people will probably have an affinity for, if they have the sort of cognitive abilities to keep up with how, because it's not people should never feel bad about doing badly at school, because school goes extremely fast. My parents purposefully taught me stuff at home to keep me ahead of school. Not all parents can do that, but it doesn't mean. But it's about what you enjoy doing and what you, where you feel like your strengths lie. So I think analytical things generally tend to be good for autistic people. But I liked the biological stuff, because it's all these interconnected systems that link together, and then you just have to remember, it's like you, how can I explain? I suppose it's like with your body, obviously the human body. So you have the brain, and you remember that the brain is made up of nerves and blah, 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 but the brain also needs to have a blood supply. The brain also needs to get oxygen and be able to get rid of carbon dioxide. So it's all of these little systems, and if you create them like I used to make mind maps of these things, and it's like if you follow one pathway you end up here, and if you follow one pathway you end up there, kind of thing. And that's satisfied the analytical part of things.
Is it that systems thinking that really captivates your brain? It's like, yes, you can figure it out. There's a system. I can figure it out. I can memorize that, and I can figure it out before it even happens.
Yes, that's definitely a big thing. I think it was, I guess the benefit that I had was that I came from a family where a lot of people were academics. And now I don't want to make it seem like every autistic person has to go to university and study. But I do think that it is more important for the autistic people who can study to study, because being autistic, you're going to be disadvantaged in the employment setting anyway. So whatever you can do to boost your profile is going to help you later down the line. So I had the benefit that I had. Oh, yes, go ahead.
Sorry. Getting that work experience from an early age too. I was speaking to Dr. Temple Grondin, and she said, push kids to go and do some volunteering. Obviously, look at their sensory system. So don't push them into a job that is sensory overloading, like what you were talking about, even with the writing of the pens. I never thought about that. Going to university and everybody around you is writing on paper, and it's, that sound is intense.
Yeah.
But going to find some volunteer work from a younger age in some of their interests and some of the things that they're passionate about, because the more exposure, yes, the more we practice, the better for us all.
Yes.
So I think that's important to not wait until university time, but start at an earlier age to kind of get your kids into volunteer programs.
Oh yeah, my parents would, honestly, I can't even remember when my parents started asking me, what do you want to do when you grow up? Because they asked periodically. They asked so many times. It was like, from when I was very young. At least, I mean, at least once every few months, they would talk about like, well, when you grow up. Also, I want to say another thing that was really important that my parents did, which I think has stayed with me to this day. They asked me what type of lifestyle I wanted. Now, when I was young, I didn't, I mean, I had this, I had this impression that I was going to be like, for example, I don't enjoy cooking. I don't enjoy cooking and making food. I especially dislike following recipes. So I used to tell my parents, when I grow up, I'm just gonna have a chef, and my chef is gonna cook everything for me.
Right.
And so this used to prompt them to say, well, if you want to be a chef, you're gonna have to have a lot of. Oh, if you want to have a chef, you're gonna have to have a lot of money. So you better pick a job that has, you know, that where you have the potential to make a lot of money. Even little things like that, I think if parents could pick up on those things and you know, sort of shape and guide the child's vision in that way, it would be.
And also to show, the more independent you get, the better for you. Because if you're from a young age, tell your children, that if you want to have whatever they want, like for you it was a chef, you have to be independent enough to have that chef in your house. So you need to you need to brush your own teeth, you need to go and buy your own groceries, you need to make your own snacks. So you start at a young age for just teaching those independent skills.
Yes.
Which is a very important point. That's, I mean, I think for parents it's important to know that the sooner they start with teaching these skills that are going to lead into an employment or independence first and then employment, the better for their child. And that's great that your parents did that from such a young age.
I also want to say, I think it's also important for parents to not see, because not all parents, so I was very fortunate, both of my parents went to university. Not all parents have done that. That was actually a shock for me to discover as an adult, that other people's parents didn't all go to university. Just shows how little contact I had with other people. But I feel like it's important to say parents who don't have that kind of background shouldn't feel disadvantaged, because again, we're in the age of the internet. You can Google everything. You can Google, you can actually do, I'm sure there are online quizzes that kids or adults can take to see what kind of career affinity a child could have, and doing that, and especially doing that over time. And if the child expresses an interest in something that you have no idea about as a parent, don't shy away from that. Don't be scared because you feel like you don't know much about that. You can go online and look together. I'm sure kids would love that if their parents would sit with them and investigate stuff. You can find people who do that, and like you were saying, that's why I think that's so brilliant what Temple Grandin said. Find people who do that thing and say, would you mind if my child just shadows you and sees what happens, and expose them to as much as possible, because the more that they can, the better an idea that they can get of what the world is really like, the more they can mentally prepare themselves in advance. Because I think that was the whole thing, is having these conversations from such a young age kind of primed my brain to be like, well, I'm going to do something. I think it's...
And also to figure out, once you're shadowing that person, to actually see, is that something that I still like? Because maybe you're in your mind, you're thinking, oh, I want to be in emergency medicine, or I want to be, an ER person, and you go on, and the sound is too intense, or the lights are too intense, something shows you that this is not what I want to do. Like you said, when you were studying medicine, it was just the people were not really your tribe.
Yes.
Part of your tribe, and it was a bit too much, even with the studying. So I think it is important to do that volunteering, do job shadowing, ask people who are in the field, what is it like, or if you can join them. That's a very important point for young adults to do, adolescents too.
Absolutely.
I think we can definitely speak about some tips. You've already mentioned some tips that parents can try and do from a younger age. I think we should see this chat as an introduction, and then we can maybe do, even if you're keen, like a monthly talk, and then we can come up with some practical strategies for parents from the people that are watching as well, and they can always share some of their knowledge as well with us after the talk.
Yes, I'm actually really keen on making this something that we can do on a regular basis, so that we can cover, because there's so much to talk about when it comes to employment, and especially when it comes to relationships. We haven't really dived into that one, and we don't have much time left. But especially when it comes to relationships, because the difficulties that I've faced and how discussing them with you has opened my eyes to this whole new world of understanding. I mean, you've been such a great source of support for me.
Really?
I would love to share this, because I'm sure, I mean, especially for people who have autistic children or autistic people who are growing up, but I specifically think that for parents, it'll give them this insight into just how different autistic children see situations, because I think you and I see situations quite differently, and we have spoken about that, but it would be so great to dive into more of that, especially on these live events where people can, you know, even ask questions, join in.
Exactly.
I think it would be brilliant.
Share some of their scenarios too, because for me it was, you know, we would speak about something, and we would, both of us actually, through the years, I would share something with you, and I said, this is what happened on this date, what do you think of it? And your advice would be so good, because it's like taking the emotions out of it and just saying, but this is what he meant, or this is what I see happened in that situation. And it's very different to like my way of sometimes overanalyzing it in an emotional way, whereas you would tell me, but no, that's not the case. And I think, yeah, it's very good, because there's a lot of misunderstandings, and this is the problem with most people in relationships, is it's just a misunderstanding. The intent is good.
Yeah, it is. Well, because we all want to connect with people. I think that's what makes it so difficult. And I think that, you know, even when you say it now, that's probably where I struggle, is that I think I often feel like, ooh, I want this, I like this person, so I want to get this person to like me. And then it clouds my own judgment, because I'm thinking, okay, I know that this is what I would really want to say if I was just being honest and blunt about it, but I don't know if that's going to make the person like
Oh, that's difficult. It's so difficult, because we're all in the same boat. We're trying to, in a relationship, whether it's friendship or a romantic relationship, you don't want to hurt the other person's feelings. You want to also come across as being authentic to yourself.
Yeah.
So it's difficult to find that balance, and sometimes, yeah, I get that, because sometimes you would feel like you're not being true to yourself. So it's kind of like, but I actually want to tell this person that I'm not okay with this, but then am I going to be rude? So I think that's it's important that we bring up possibly some scenarios of what happened in your relationships and how you analyzed it and how I would have analyzed it, and just seeing that difference, because that's how we learn from each other. And then, you know, the next time you can say, oh, but I think Carla would have thought about it like that, and I'm thinking about it like, or the other way around. I do too in my relationship.
I think it's so valuable. It's so valuable. I mean, just the idea that, because obviously being autistic and being a woman, this is one of the big things that I'll never forget reading this in one of the books that I bought on autism and relationships, that they specifically had a chapter on dating for autistic women, and they said, because you can't read the signals, you're at so much higher risk of being sexually assaulted, abused, coerced into things you don't want to do, all that kind of thing. And that, I mean, it speaks to my experience to a certain extent. I mean, I understand why they say that, and I've had experiences where I wasn't really ready for certain things, and the other person was like, but, you know, and I was like, and I didn't know how to, and that's the whole thing, because it's almost like you have to learn a sort of a language dating, to communicate with people. And if you don't have a support system like girlfriends, you don't have people that you can talk to about these things. You don't have someone that you can go to. So I feel so blessed that I've met someone like you who can do the girlfriend chat with me, you know what I mean? And analyze the dates and be like, oh, this is how it was.
Don't take it as the truth, though. We need to maybe do an experiment. Maybe what I'm saying is completely wrong. So
I can tell you, you've never led me astray. I mean, okay, I'll put this one out there. I'll slide this one in here. There was a time when just this last relationship that I was in, at the beginning of the relationship, you said, I described the person to you and you said, sounds like there's a lot of mental health issues there. And I was like, no, how can I know? That's ridiculous. Like, I think mental health issues are fine. I can deal with it. I've studied medicine. I'm a doctor, blah, blah, blah. I have mental health issues. I'll be fine. And those same mental health issues were exactly what caused this massive implosion. I actually sidestepped a bullet because when I saw how severe the mental health issues were, I immediately pulled back because of what you said. I mean, it rang in my head like a flipping, church bell or something, like ding, 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 ding. Remember what Carla said?
You know what I want to share, and I hope it's okay that I'm sharing this.
Yeah, go ahead.
But one of the things that was a bit, it didn't scare me, but I thought, why is she thinking like this? Is the one thing you said is, I have mental health issues, so it's fine for him to have mental health issues. And to me, I totally get the notion of accepting people for who they are, and we've all got challenges. But I didn't want you to feel like, because I'm autistic, I need to go and find somebody that is maybe depressed or anxious, or because I don't know what that was. Like, I don't know if it was that I don't deserve somebody that is not with any issues or challenges. That to me was a bit, I actually still wanted to talk to you about it, so now we're doing it live.
No, if it helps other people, that's kind of cool. That's interesting because I want to say that I didn't think about it that way, and now that I am thinking about it that way, I almost feel like I think I'm hard to deal with in a relationship setting. I'm hard to deal with anyway, and I feel like people who have their lives together, what I used to think was have their lives together, because now I have a very different impression, especially after that last relationship. I have my life together. I'm doing very well. I feel like I'm doing very well. But I have this sort of underlying belief that, like, I'm like difficult to love because I'm autistic. So someone who is easy to love won't be like, I mean, not that they won't be attracted to me, but they'll have a hard time with me. So maybe I should find somebody else who's difficult to love, and maybe we will find each other, like there'll be some kind of, like, I guess it's hard to explain. I suppose the idea is, well, that person will also understand what it's like to have difficulty in relationships. So they'll be grateful that we found each other, which, when I say it, it sounds ridiculous. It sounds ridiculous. But it's like almost like I think.
That should be a talk on its own, really.
Yes. It's like, it's almost like, well, I mean, they'll also know what it's like to have a hard time in relationships, and I'll know what it's like, so we'll appreciate each other and be kinder to each other. But that's obviously not how it works. I think that's the biggest lesson that I've learned, is that it's not, you can't, that's not so these sorts of things, like if you break things down into, and that's what I wanted to say about you were saying you take the emotion out of it. Sometimes when you break things down rationally, if it was a chemical experiment or if it was a mathematical equation, this kind of stuff would make sense. But because you're dealing with human beings, it's not like that. It's just, it doesn't, the human beings don't fit into these nice little test tubes where you can just go, oh, I'll pour it into here and it'll react like this and that's all that'll happen. No.
Yeah, you can't figure it out like a system,
Yeah.
Change from day to day. And I wish actually you could. Like, I'll tell you a personal story. just before we need to probably wrap up. But with my partner, who's on the spectrum, I can sometimes figure out when he is not really understanding why my mood changed. And I could see on his face, he's like, but she was fine up until now. Nothing changed in the environment. Why is she all of a sudden moody now? And it could have been something completely unrelated. You know, it's just, you know, something that I remembered or whatever the case is, but it wasn't black and white. It wasn't apparent. So it's confusing. And that's the same thing with every other person out there. You don't know what they're thinking. So you don't know what they're going through. And then all of a sudden, the mood changes and the interaction changes. And that's very confusing for somebody that struggles already with the differences in social interaction and differences in people's mood and, you know, like the way that they change from one second to another.
Yeah.
So
no, absolutely.
That's a topic that I think we should discuss more.
I definitely. I want to say for me, it was always my younger sister was, she always, like, I feel so bad thinking about it now as a grown-up, and we have spoken about this, but I had that same issue with her, that something would upset her, or I would upset her, and I would have no clue and act like everything was fine, and she'd be like, why isn't she getting that she's hurt my feelings? You know? So yeah, no, I know that quite well.
But I think for me, like, ever since I've been working with autistic people, which has been the last 16 years now, I wish that it was more honest and upfront, and people could say, I'm irritated about you because you said this and this and this. Not kind of just change their attitude, because it's so abstract. You don't know why the person has changed all of a sudden, and there's no label that they're putting up and saying this is the reason, or there's no reason, an apparent reason. So it's so important for us to have that understanding from both sides. I don't want to make it seem like it's different sides, but to also know that if you're a person with an autistic brain, you're not going to just get a quick switch from somebody's mood. The person has to, if you're in a relationship with that person, the person has to actually tell you, I am angry because this and that, or I'm not angry at you, I'm irritated about a past event or a future event. You know, us women have, like, always some reasons that we're angry about, but, you know, and it's nothing to do with you. Just to kind of let that person know that everything's fine. We'll go back to our relationship in a bit. I just need some time alone. So I think it all boils down to communication. That would be so helpful. I mean, just the fact that, I think also the fact that being autistic means you don't always notice that the person's behavior has changed. It takes quite a while, because I know that when people's behavior changes towards me, I mean, it's even worse nowadays because we communicate so much via text and that kind of thing. If someone's upset with me, I struggle to even pick it up in the first place. It takes me a while. Like, the person has to get a little bit aggressive, or they do have to verbally somehow, or in writing, express irritation or frustration before I actually pick it up and click, oh, hold on, behavior has changed. Okay, something is not right. Because sometimes I think if people become, say for example, quiet around me, I think, oh, you know, maybe they're just tired of talking, or maybe I spoke too much and now they need a break. You're kind of guessing. Is it more of a guessing thing that you're just kind of?
Yes.
What is it from?
Well, because I think first of all, it's guessing what the other person is, what the behavior means, and I must say 80% of the time I guess wrong. But first of all, it's guessing what the behavior means, and especially if it's someone you don't know well and you haven't had the chance to be around them to see what their kind of baseline is. It's hard to even tell that there are deviations from that. So that's the first thing. And then the second thing is, if the person is upset with you and they make it clear that they're upset with you, what did you do? And then I mean, that's always a minefield, because then in my mind, I'm going through every conversation that we've had, and I'm, you know, maybe it was this, maybe it was that. And again, usually the problem is that usually the conclusion that I come to is wrong, because I'm thinking, again, in my autistic way, like, oh, I wouldn't like it if someone you know, whatever, made this and this noise, or X did, and the other person's thinking, no, you said, you know, you said my baby wasn't cute or something, you know what I mean? Like, it's something completely different that I don't even have a,
That is,
yeah.
I think we need to brainstorm. We can obviously ask some people for advice from their side too, but brainstorm of ideas of how we can bridge that gap, I guess, because there's a gap in between what has actually happened and what the understanding is of what happened, and how
Yeah.
to communicate those. It's just knowledge. Like, you want to know what you did right, what you did wrong, and I think if we are a bit more honest about these interactions and our feelings, then it will be easier. But we've actually gone over the time, so thank you so much for the people that have watched and that have stuck with us, because we had a bit of a difficult start. But Sarai, thank you so much for this chat as well. I think we should definitely try and do it more often.
Yes, thank you. I'm actually so looking forward to it. It's been fascinating also to hear your perspective, also from your background, because we talk as on a personal level, but it's so interesting to hear you bring in also your professional experience and what you bring to the table. I mean, you bring a hell of a lot to the table. You have so much experience. I fangirl hard about you. I mean, it's been amazing, and I honestly think that by doing these kinds of, or holding these kinds of discussions, I think it'll give people a chance to like look in